Some babies will have problems with the digestive system, so they may not be able to poo properly. So vast majority of babies who are breastfeeding may not poo every day. So some of them poo every few days. That's because the breastfeeding baby will absorb most of what is being fed.
Right.
And there'll be very little residue to be expelled and pooed out. So there's something something that parents shouldn't worry too much about, as long as the tummy is not distended. A child who's got a distended tummy, who's starting to vomit, especially the vomit is green, you need to worry about an obstruction. So those are the situations when you need to visit a surgeon or a pediatrician to rule out any problems, which is a structural problem or functional problem where the bottom doesn't open up, or there's a problem with expelling feces.
So a bloated tummy and green vomit.
That's
and
right.
And the green being bile.
Green is bile vomit.
Right.
Yes.
Okay.
Bile is being produced into the intestine from the liver.
Yeah.
Just beyond the stomach.
Right.
The stomach is the first part of your intestine in the tummy.
Yeah.
You swallow into your esophagus and it goes to your stomach. And once the food passes the stomach, it reaches an area called the duodenum. That's where the bile enters the intestine. So if you got obstruction further downstream, then when there's your food can't go beyond that, you start vomiting.
Right.
And you vomit the bile that's been produced, and that goes to your stomach and you expel it through your mouth.
Okay.
And once you get bile vomit, it's indicative of an obstruction in your intestine. If you have a child who's vomiting bile, then you need to take the child to a hospital or see a doctor, and they will assess whether this is an obstruction causing the bile vomiting. So one of the things that we look out for is whether there's a functional problem where the bottom doesn't open up, or if there is a structural problem where there is a blockage in your intestine. So all that will be investigated. So something that's related to the bottom end is where the nerve is not relaxing the muscle of the intestine very well, whereby the child is not expelling, or the bottom is not made properly. So the bottom may be a small opening, or the bottom may be in an abnormal position, whereby the child is not able to poo out.
This is investigated in the hospital by yourself or by a doctor.
If the child has got an abnormal position anus, or abnormal size anus, or the bottom is not opening up adequately to allow the poo to come out, then we will examine the child to look out for what the problem is, and also probably do some investigations, as in x-rays investigation or ultrasound scan investigations, to look out for what the problem is.
And should that problem arise, what is the typical treatment that is required?
So there are a few different conditions. If the condition is a simple functional problem where the child is not pooing properly, we might need some laxatives. If there is some other issues with the position of the anus, that will require surgery. And that will depend on what the condition is.
Okay. All right, understand. But basically, so the key message is, should your child be having a distended tummy, a bloated tummy, and as soon as they start vomiting a green color kind of vomit, do not delay. Go see a doctor. Go to the hospital.
That's right. Yes. So distended abdomen, bile vomiting is a sign that there's something blocking the passage of the intestine.
Right. Okay. Thank you, Doc.
Thank you.